That is not happening. Whenever we get a COVID report from a death certificate, we go back and validate that they have a positive test.
And because of the surge in coronavirus cases, state health leaders are growing more concerned about the virus's impact on hospitals across the Magnolia State. Take a look at what's coming up behind me. This is a graph on hospitalizations, and this only applies until yesterday. We actually have new numbers for today that show, I believe we're up to 940 hospitalizations. Red line here, patients with confirmed infections in the hospital. Again, yesterday 909, we're up to 940. Also want to point out ICUs. ICU patients are along this orange line right here. It looks like it's pretty much staying level, although there is a slight uptick. At last check, 210 patients in Mississippi ICUs. Obviously, this is a concern because you're seeing the main thing, this red line right here, it's trending upward. This is the last thing that they want to see. They do not want to see an increase in hospitalizations. Also, I want to show you this new graphic right here. What this is from the State Health Department is the number of hospital beds statewide that are in use. More than 3,300 are non-COVID. More than 2,200 are available, and then 909 are people with the coronavirus. So obviously, what they're not wanting to see is a spike up in either one of these. They don't want to see this middle number down. There is a concern by the state that they're going to run out of hospital beds, and already in the past several days we've heard story after story from the state health officer about how hospitals here have been trying to scramble with other states trying to find hospital bed space because Mississippi hospitals simply don't have it for a particular patient. One story we told you about last week, Dr. Dobbs mentioned that they tried to send somebody to a Louisiana hospital. They didn't have room. They found a bed for that person in Alabama.